Well, let me defer. I'll wait till.
Mr. Thurman.
Well, thank you, Mr. Chair, and Chair Brown, and thank you, Mr. Gibson. Seeing Senator, good to see you again. Everybody's piling on. I guess I'll pile on too.
That's okay.
But they always say that we don't give anybody anything that they can't handle, and I know that you can. I know that you care about these issues. I appreciate the rigorous conversation that we had in the subcommittee, the budget subcommittee for Health and Human Services, and I've had a chance to work with some of your staff, and I know that they often feel overwhelmed with the number of inspections. Just the caseload volume is just so high. So I do know that. Having said that, I agree with the sentiment that everyone is saying that we have to do more. But I ultimately think that that's up to the governor to put enough money in the budget, and it's up to us to make legislation around the regulations for the caseload ratio, right? So I'm not going to ask you to define it, because you defined the caseload ratio stuff pretty well, the 3.2 hours per patient days. That makes sense. I think what I would ask you is just what best practices do we know now that a nursing home should have this many staff for this many patients, just so that we can be thinking about recommendations for changes in legislature. That's our responsibility to propose legislation to make those changes. But I'd like for you to share the best practices that you see, because if you don't have the people power to get the job done, then we can't hold you accountable. And I've been to some nursing homes, where I visited folks who were living in hospice, where I left there and I thought I would never want to be there. And I thought to myself, we ought to pass a law that says a nursing home administrator should have to live there. Because if it's not good enough for you to live in, then it's not good enough, right? And so until we get there, we're going to need to have some best practices about what really is a suitable ratio. And so I'm assuming that the law, as it currently stands, the 3.2 hours per patient day, probably just doesn't get at it, because every one of us up here has heard from folks who work in nursing homes who say, we're not able to see patients enough, and patients get sick as a result. And so I'm asking you, what is the right best practice for what a ratio, if you have 15 patients, you should have this many staff? Give us some best practices. What has experience told us about what's the right way to approach the proper staffing?
So we don't have data right now. We haven't looked at that question of what connection you can make between a staffing level and the quality. I would just reiterate that we do have the ability to hold facilities accountable for having staffing that is adequate for their residents. And so you will have variability from facility to facility, or even within a facility, depending on whether you might have an outbreak of influenza, on what the staffing needs are to adequately attend to those patients. And when we determine from being in the facility that the patients are not being adequately cared for, we can cite them for not being staffed adequately. But we do not have research to address what is the right level, what is the right ratio, or even right at this point we don't have any data. We have not looked for data to assess the effect in a scientific way of staffing on quality.
So, and I'm not a scientist, I'm going to use common sense math on this, right? I'm going to use a common sense approach. I think that while the data may not be codified, if we ask people who do the work every single day, your staff who go out and do the inspections, if you ask people who work in nursing home, nurses and CNAs and others, and you look at the places where there have been incidents, that we could make some reasonable recommendations for what a good number should be for ratio, right? I'm saying common sense, right? We know when you got fewer people, you can't do as much. And so, but if you've got some stakeholder groups that you use to help in making recommendations about how many days, after there's a complaint that a report should be completed. If we use those stakeholder groups, if we engage the folks who work in the nursing homes and the patients themselves and your staff who have to do the inspections, if we did that, I'm guessing that we could make a reasonable recommendation for what is a guideline for good staffing ratio, right? You do have a stakeholder group, right, that you use, right?
We have we have public stakeholder meetings and a list of people that have asked to be part of that. We also meet on a quarterly basis with numbers of different groups of our stakeholders.
Have you ever asked that stakeholder group to take up the question of examining the number of places where there have been incidents? And when you look at those nursing homes where there were incidents, you look at what the staffing ratio was, not ours, people to people. And have you ever asked the stakeholder groups to examine that question directly and to make a recommendation?
We have not asked that question.
Got it. So we're going to see you tomorrow in the subcommittee, aren't we? So tomorrow I'm going to ask that you and your team make such recommendation to your stakeholder group. I'm giving you a head start on the homework. I was always that kind of student. I like getting a head start on the homework because I like to be able to get it done, and sometimes I need extra help. I'm giving you advance notice about something I'm going to ask you about tomorrow, and I'm also going to ask you about going back to community care licensing. I agree. If we spend all of our time talking about how much time it takes us to respond, we already know that the best prevention is actually prevention itself. But I understand we do need to have a system of actual response when there are incidents. I just came from a committee hearing where we approved a bill that would say that community care licensing needs to do annual inspections instead of 3 years, instead of 5 years. And I know that there's been wide debate about this, but I think that annual is what it should be. I agree with the bill. I want to ask you, what would it take for the department to ramp up? Should this bill pass the Assembly and the Senate and become law, what would it take to ramp up to be able to do the annual inspections from community care licensing?
So the California Department of Public Health does not license community care facilities. That's the Department of Social Services.
But you end up hearing about it in the nursing homes and so what would your sense be about what it would take to ramp up from a staffing standpoint, from a training standpoint? What sense do you have, if any?
Honestly, Mr. Thurman, I really could not comment. I don't know what their current staffing level is. I don't know what their current policies or procedures are. I could not address the workload of another department.
Would it create a benefit for you if community care licensing was actually doing annual inspections? Would there be any overlap between the sectors that we're talking about where there might be some benefit to the folks who are in nursing home situations?
I don't know.
Got it. Okay, I'll look forward to seeing you in the subcommittee hearing tomorrow, and I hope you'll have your homework prepared. I'll be asking directly about best practices that your stakeholder groups can help to provide for us on this question of caseload ratio, staff to patient caseload ratio.
Okay, thank
you.
Thank you, Mr. Thurman. We're going to go with Mr. Gibson, then Chair Brown, and then we're going to go to the next panel.
Thank you very much, and I'll make my questions and comments quick. This is for the department again. How many facilities have you cited to date?
I don't have that information in front of me, and we could bring you that information. And do you want by year, or we will bring you that information?
Does the state auditor have that have information based on your audit?
No, we don't have information with respect to the number of facilities that they've cited. We have actual cases that they've investigated or in the backlog.
Okay. If you could certainly give to date, and I would just say from 2014 to date.
Certainly.
That would be helpful. Have you closed down any facilities? Have there been any facilities closed down?
So recently, the most recent facility that closed the Department of Public Health issued a temporary suspension order against the license of a facility called Wishaya, and as a result of that temporary suspension order, the facility chose to surrender their license, so the facility did close.
But you didn't close it down.
Well,
they surrendered the
we
license.
suspended their license, and their license would have remained, according to the temporary suspension order, the license would have remained suspended or moved to revocation based on actions of the facility to correct the problems that caused us to issue the temporary suspension order. The facility decided that they would not or could not address those problems and surrendered the license.
What happens to when you actually find a facility? Where does those dollars go to?
So there's a state citation penalty account There's also a federal citation penalty account, so they go into citation penalty accounts.
Do you know how much has been collected, which could certainly give a representation of how many?
I do not have that information in front of me. I know we do have that information available.
Okay. Best practices. What do you think? Can you handle this job? Can the department handle the number of outstanding complaints? Can the department move forward to address patients' needs? Just a question.
I am fully committed, and the department is fully committed to addressing these issues.
So you can handle them. So the next report that you have to provide, which is in 6 months, if I'm not mistaken, then the recommendations that the state auditor has made, we should see considerable changes in terms of implementing those recommendations.
Yes.
And do you agree fully with all the recommendations that the state auditor has recommended?
We did not agree with every recommendation of the state audit report.
Which recommendation?
The recommendations dealing with setting target dates for completions.
Okay. It's my understanding, my sister's a nurse, a nurse in the hospital. It's my understanding that nurses also, they have a patient ratio in the hospitals.
That is correct.
Is that your understanding?
Yes, there are nurse-patient ratios in the hospitals set in.
So
yes.
There was a methodology that was created that to suggest that there should be a nurse that should be on call on the floor that will handle these amount of patients on that floor.
Yes.
And that ratio is being implemented in the hospitals.
That is correct.
And I have a hard time understanding why you can't implement, or your department can't implement something like that for nursing homes. I don't care if it's 3 people in a nursing home, you can still suggest that there should be X amount of skilled individuals to handle, to monitor, to watch that patient. And you know, I'm very frustrated because at some point I may need a facility. And damn it, I would like to have someone to take care of my butt when, in fact, in that facility that's going to watch and monitor me. So if I want it now, then I should want it for the individuals who has to go to these facilities now. There should not be an answer given, at least while I'm on the committee, that you don't know or you can't provide the kind of answer that will address. Or I haven't even heard you say that we will add into a plan. We will suggest it at our next roundtable discussion, or we will have it at our next staff meeting. Something. But to suggest that once we leave from here, it's just a question that's out there in the wind, that's unacceptable. It's unacceptable. Mr. Chair and Madam Chair, I don't know what has to take place in order for that to be part of a policy. If they can't do it, then we should be able to do it. And if we can't do it, then damn it, we need legislation that demands and direct them to do it. Because patients' care is in jeopardy as a result of that being absent. And if the hospitals can do it, why can't you do it? That's all.
Mr. Mathis.
Just point of clarification here. For my fellow members and members of the audience, folks at home, I don't believe it's the question. The care facilities do have that number per patient capita ratio, correct?
It's set in statute.
Okay. So I think the reason why we're upset, it's not the nursing homes versus the hospital care ratio. Those are set. I believe our stakeholder perspective is going to address that issue more firmly on the next set of panel. However, I think the issue and the care for concern, ma'am, is what I've already stated, is the fact that you and your agency does not have that ratio formula. And I believe that is what needs to be addressed, what needs to be done. You've been given a recommendation in your audits to address this, yet your department does not agree with that recommendation. And I see in that is the problem. and whether as a committee or what, we're going to have to either figure out a legislative reaction to your statements or hope that within the next 6 months your department decides to do something further and take that recommendation into some deep consideration. Thank you.
Thank you. Quick question for the auditor. The auditor report included some recommendations to set a time frame for closing investigations, and we just heard that the department didn't agree with that recommendation. Did you have any specific suggestions on how long that time frame should be?
We didn't specify the time frame within the audit report. As I indicated in my testimony earlier, there was a time frame in the past that was 40 days with an additional 5 days to close. We think it should either be that or at the most probably 60 days. I don't have anything specific to use as a benchmark, but what we think is critically important is you have to have, as some of the members of the committee indicated, I think Mr. Mathis in particular and Assemblymember Wood, you have to have a time frame to strive for. Certainly there will be exceptions to the particular time frame, but you've got to set something so there's an expectation. And then as you develop more metrics and have more information, you can determine whether or not that's a reasonable time frame, and if not, why does it need to change? But that time frame will drive performance, and then it will also drive data. The performance metrics on their website is helpful, but really it's showing you that they expect something to be done within, well, they're showing their metrics less than 90 days, I think 91 to 120, et cetera. But it's not setting an expectation, and that's why we think our recommendation is particularly important.
I agree. Thank you, Ms. Howell. And Ms. Iacino, we heard that you used to have an internal time frame and then you no longer have it. Do you have a philosophical objection to a time frame, or are you like in an assess mode where you're trying to figure out what the new time frame would be? You can hear from the members up here we're really interested in a time frame. We have a bill this year that includes a time frame of 40 days. Ms. Brown's carrying that bill. Chair Brown. Do you have any input on that? I mean, a lot of the members up here think it's time, not it's time, but in the absence of some action on your part, we need to step into that gap and act. So what is your view of a 40-day time frame and time frames in general?
We are aware of the legislation, and it is under review, and I cannot comment at this time on a position on that.
Okay, and just to clarify, I want to know if you have a fundamental objection to a time frame, the concept of a time frame, or are you just undecided at this point and not prepared to say one way or the other?
We are trying to assess what we need, what we can perform, and so that we have a better understanding of what time frame might look like.
Okay, thank you. This bill's moving now,
yes,
so we're inviting your input. We had some points by Mr. Thurman about best practices, and you're on the ground doing the work, so it's always better to have legislation informed. So I've asked for that input now. You're not ready to give it now. I understand. Please give it when you're ready. We're going to go to Ms. Brown. Chair Brown.
Thank you. Thank you so much. It's been a robust discussion. It has been very enlightening. And I want to focus more on you and your department rather than the nursing homes. I want to focus on how you do what you do. It seems to me that there seems to be some problem with accountability. First of all, you started out telling us how many homes, nursing homes, hospitals, everything that you had. This particular hearing is just about nursing homes. So there are 1,200, am I right? 1,200 nursing homes?
Approximately, yes. And
you focused heavily on Los Angeles. There are how many in Los Angeles?
About a third. I don't have the number in front of me.
Okay, well, as I understand, it's about 430 in Los Angeles, and it seems that you're talking more about Los Angeles didn't do something, and it's just a part of the whole state. So what are we doing in the other parts of the state? What kind of oversight do you have on all of your different departments or district in the district? The other thing is, you asked the question about, you said that the plan, the corrective action plan, is going to take 4 years. Why does it take so long? Those are just a few things that I'd like to know. And yes, I'm hoping that you will see that AB 348 will give you the structure you need. Seems that there's no structure that's being followed. So everything's falling through the cracks. So I'm asking you the question, why is it going to take 4 years for the corrective action plan?
So the 4-year time frame is following if the budget grants the new staff, it will take us 4 years to clear the open aging complaints. One of the reasons that it takes a long time is because once we hire a new staff person, that person requires a year or more of training to be fully qualified to conduct all the workload.
Okay, so if it takes 1 year, you're saying still that the corrective action plan is 4 years.
That's to address all of the backload. That's how we calculated the number of staff, is to clear the backlog over the open aging complaints over the course of 4 years.
Is it true that you have more supervisors than you do staff? Or what is that staff supervisor ratio?
In the estimate, the way we figure personnel is a staff supervisor ratio of 1 to 6, 1 supervisor for 6 nursing
Now,
staff.
if you have 1 to 6 supervisors, 1 to 6, the staff ratio for your department, then why don't we have a staff ratio, as my colleagues were asking? Why can't we have a staff ratio for the homes, the nursing homes?
And there is a staffing standard in the statute for the nursing homes.
But you don't have a ratio.
No, and so
It's not for the nursing home, sorry. Not for the nursing home, for your staff. You have 6 employees per supervisor. How many of those 6, each one of those employees?
Please talk in your mic.
You have 6 people with 1 supervisor. Out of those 6, per each one of those, how many nursing homes does that one employee work with? What is that one employee's caseload?
okay,
I believe that was the question, Chair Brown.
I'm sorry.
The caseload per the employee.
Yes.
So you have 6 employees, 1 supervisor. How many nursing homes is the one? Not the nursing homes stats. We're not discussing the nursing homes. We're talking about your staff members, ma'am.
I understand the question now. Thank you for that clarification. So we do not, that is a facility count per surveyor is not how we estimate our workload. We estimate it by activity type and the hours it takes. So, for example, each facilities differ in their size, in their bed capacity, in the quality of care they give, in the number of complaints and entity-reported incidents. So we don't assign the workload in a facility per surveyor ratio like that. We figure it based on standard average hours to complete particular activity types averaged over. We do it by facility type, but averaged over 3 years.
Okay, I think I had one more question. Has the number 1 recommendation that Mr. Joy made, has that been achieved? First of all, we need to go back and say, what was his number 1 recommendation? Mr. Joy, you can tell us, Ms. Howell, or...
Yeah, we had kind of equally weighted about 5 or 6 recommendations. Yeah, if I had add one, it's a similar theme that's kind of floating through this committee. That is to establish clear targets and to measure performance against those targets and compare performance amongst the district offices against those targets and identify which need help, which are doing well, share best practices. That was a long answer, but long story short, set targets, measure performance against them.
Okay, so from our answer earlier, do you think that that recommendation has been or will be achieved?
The department's clearly making steps to make public performance information about its timeliness of doing surveys and investigating complaints. But I think it's important to take the next step to establish targets for all the key performance indicators.
You're so diplomatic. Thank you so much. Thank you so much. If there are no more questions, we'll move on to the next panel. Thank you very much for being here.
Thank you, panelists, for your participation.
Can you ask the department to remember to come back at the end of the hearing?
And if the department would remember, we would like to have you come back after the end. We'll have another panel. We may have questions. This next panel is the stakeholder perspective. We have Patricia McGinnis, Executive Director, California Advocates for Nursing Home Reform, Kim Coward, Chair, Bargaining Unit 17, SEIU, Local 1000, Melanie Boston, Health Facilities Evaluator Nurse, and that's SEIU, Local 721, Matthew Robinson, Legislative Director, California Association of Health Facilities.